Is it true that Medicare Supplement insurance companies can deny you if you have a pre-existing condition? Well, today I'm talking about exactly what types of pre-existing conditions could count against you when it comes to Medigap insurance. So stay tuned. Hi, my name is Stephanie Apt. I am an independent Medicare broker, and I help seniors across the country to navigate and understand the world of Medicare. If you find these videos bring you value, please take just a second and subscribe to the channel. You can like the video and please leave your comments below. I always really like to hear what people have to say about these topics that we review. Also, be sure to stick around to the end of this video. I'm going to share some Medicare Supplement bonus tips that I think you'll find helpful. Now, in talking about Medigap plans, these are the plans that pay the co-insurance, the deductibles, and the cost share that original Medicare doesn't pay. These plans offer you all of the doctor and hospital provider freedom of original Medicare. And in many areas, you can get a Medicare supplement plan that offers close to 100% medical coverage for about $90 to $150 a month. There are many common misconceptions that people have about Medicare supplement plans. And one of the biggest is that lots of folks don't realize that Medigap plans are typically medically underwritten plans. This means that you have to be healthy enough to even qualify for a Medigap plan. Now, the Affordable Care Act, or the ACA, did away with pre-existing condition exclusions for folks under 65 in the individual health insurance market, but not for Medicare supplement insurance plans. Aside from just a few states, in most states, you do need to pass through medical underwriting to qualify for a Medicare supplement plan most of the time. And today we're going to talk about exactly what that medical underwriting looks like. Now, there are a few times that any Medicare beneficiary can get a Medicare supplement or a Medigap plan without any medical underwriting. Any insurance carrier that offers the Medigap plan must approve you at their preferred rate, regardless of your health. There's no health questions, there's no medical underwriting. And this time is when you're either first turning 65, newly eligible for Medicare, or first adding Medicare Part B. At this time, you get a true Medicare Supplement open enrollment window. And this is generally the best time to apply for a Medigap or Medicare Supplement plan because you have your pick of any plan with any company and it's guaranteed to be approved. Now, there are also certain guarantee issue situations when it comes to Medicare Supplement insurance. These are certain life events that qualify you to enroll in certain Medicare supplement plans without medical underwriting. And not all Medicare supplement plans are guarantee issue plans. One example of such a qualifying life event would be if you had a Medicare Advantage plan, you moved out of your Medicare Advantage plan's service area. At that point, you would qualify for some, but not all, some Medicare supplement plans without medical underwriting. Aside from these instances, in most states, you will have to go through medical underwriting to qualify for a new Medicare supplement plan or to change your Medicare supplement company or to change your Medicare supplement plan letter. So what exactly does this underwriting consist of? Well, let's say you're 70 years old, you've been on Medicare Part A and B for 5 years, so you're past your open enrollment period, you're not experiencing a guarantee issue situation. You will have to answer a series of health questions on your Medicare supplement application. And an underwriter at that insurance company will review your application and determine whether or not you qualify for coverage. There is no physical exam required, and many conditions like having high blood pressure, high cholesterol, you take a thyroid medication, these types of things don't count against you. They generally aren't asked on the application. Most insurance companies, if you're going through medical underwriting, have a few main things that they will ask about. First of all, most all insurance companies will ask, as part of the underwriting questions, if you have any type of pending or upcoming tests, treatments, surgeries, or therapies that have not yet been performed. So if your doctor recently recommended that you have joint surgery or cataract surgery that you haven't had done yet, or let's say you have an upcoming diagnostic test, that is generally going to disqualify you when it comes to medical underwriting. Additionally, most insurance companies will ask if you've recently been diagnosed with or treated for cancer, heart attack, or stroke. These insurance companies generally have between a 2 and a 5 year look back period for these conditions, and the amount of time varies from one insurance company to another. You'll usually also get asked about lung or respiratory disorders like COPD or any disorder that requires the use of oxygen. If you have diabetes, they will ask about complications like neuropathy, or if you have a history of certain types of heart diseases or complications related to the diabetes. And lastly, there are other types of chronic conditions that could lead to a decline in underwriting. Things like systemic lupus, multiple sclerosis, rheumatoid arthritis, and other types of chronic conditions. Many people who are in generally good health have no problem qualifying for a Medigap plan or qualifying to switch their plan, but this is where working with an independent broker can really help. We work with all of the carriers in most areas, so we're very familiar with how the medical underwriting criteria can vary from one carrier to another. For example, if you have atrial fibrillation, there are some carriers that will decline you and other carriers will accept you. So working with an independent broker can put you in the best possible position when it comes to medical underwriting for a Medicare Supplement plan. In closing, there are a few bonus tips that I want to leave you with today. The first is, don't assume that you can change your Medicare Supplement plan automatically every year. In most cases, once you are no longer new to Medicare, you will have to go through medical underwriting if you want to switch your insurance company or switch your plan letter in the future. Because of this, you always want to make sure that you're picking a strong and competitively priced insurance carrier for your Medicare Supplement plan. Also, Medicare Supplement plans are guaranteed renewable for life. So once you enroll, your insurance company can never cancel your policy due to anything other than non-payment, and the insurance company can never raise your rates based on your specific health. My last tip, if you're in relatively good health and you've gotten some rate increases on your Medigap plan, don't be afraid to shop around. Medigap plans are standardized, so a Plan G with one insurance company is always exactly the same as a Plan G with any other insurance company, but the rates can vary quite a bit from one company to another. So as long as you can answer no to most of the questions that I talked about in this video, it's very likely that you can save money by shopping your Medicare Supplement plan. As an independent broker, that's what we do. We help people shop their Medicare Supplement plan and help them save money doing so. Additionally, when you're our client, we check in with you and do an annual policy rate check to make sure you're always on the best policy at the best price for your needs. Our service is 100% free of charge, so there is no fee at all to use our service. And if you'd like any more information or would like to see some free, no obligation quotes for your area, please feel free to reach out to us. I would be more than happy to help. Thank you so much for watching, and we'll see you soon.